I'm a newscaster from Nursing Channel 12. Nursing students today are learning copious amounts of information on different medical conditions, diseases, medication, and so much more while they're in nursing school. One of those topics is termed anemia. We are here at Concordia University Hospital talking with an RN who had a patient with just that, anemia related to blood loss. Back to you, Taylor.
Thanks, Nursing Channel 12. Taylor here. I'm live at CUW Hospital after just caring for a very ill patient with severe blood loss anemia related to a perforated duodenal ulcer. For all the nursing students out there, I'm going to be analyzing this specific patient's case and teaching you about all the important things to know about blood loss anemia. Moving on to our patient profile. This patient was a 37-year-old female who presented to the emergency department with blood in her stool, severe abdominal pain, paleness, lethargy, and shortness of breath. A patient with anemia related to a GI bleed would often present with symptoms similar to this. Upon diagnosis, the patient found that she had a hemoglobin level of 6.8 and a hematocrit level of 28.1. Normal hemoglobin is between 12 and 15 for a woman, and normal hematocrit is between 36 and 48. So she was heavily off. The patient then received an EGD, which confirmed that she had a perforated duodenal ulcer. Upon this assessment, the patient was admitted to the medical surgical floor and received 3 units of packed red blood cells to combat the anemia. Finally, on the third one, her hemoglobin tested at a 9%. Therefore, she became a candidate for surgery. Anemia has many forms. However, for the purpose of today's newscast, we will focus solely on anemia related to blood loss. Acute blood loss anemia occurs from a hemorrhage caused by trauma, surgical complications, or diseases that affect the vascular integrity of our bodies. As discussed, like the patient in question, patients will generally present with lethargy, tachycardia, hypotension, pallor, shortness of breath, palpitations, hypoxia. Bleeding may also be evident if they're bleeding externally. However, internal bleeds require further assessment pieces. The patient's stool, urine, and vomit will need to be assessed for blood as well. Labs will need to be drawn to assess the extent of the blood loss, as well as diagnostic features like an EGD in the case of our patient or colonoscopy to assess if there's an ulcer. There are 2 major clinical concerns with the blood loss. 1, the patient could go in hypovolemic shock. 2nd, the patient's body can preserve its volume by using plasma, which would decrease the body's oxygen supply. Interventions need to begin immediately. The most pertinent intervention for a patient diagnosed with blood loss anemia is the replacement of all the fluids that were lost. This is done with 2 large bore IVs, one containing fluid, one containing the blood product. During the transfusion, the patient needs to be closely monitored for transfusion reaction and anaphylaxis. This is done with frequent vital signs, frequent respiratory assessments, and IV site assessments. The patient may also need supplemental oxygen to control hypoxia. They may also need PRN pain medication and antiemetics to control their nausea and vomiting. Upon completion of the transfusion, a hemoglobin will be drawn again to determine if the transfusion worked. Upon the transfusion and a positive hemoglobin result, the patient's a candidate for surgery. Following surgery, the patient will recuperate within the hospital. Once she is able to go home, she will discharge with multiple consults for nutrition to ensure her diet is high in protein and low in fat. She will also need to consult her primary care physician for her new prescription for the PPI to decrease stomach acid secretion and for the ferrous sulfate to increase erythropoietin. She will also need education on the cessation of NSAID use, alcohol, and smoking cessation. This brings me to my most crucial element on teaching here, smoking cessation. The journal article I found highlighted the fact that people who smoke have increased risk of many diseases, especially gastric diseases like ulcers and cancer. Smoking decreases prostaglandin synthesis and bicarbonate, making the stomach more acidic and a breeding ground for ulcers. This article states that despite medical intervention, 25% of the population continue to smoke. Therefore, nurses need to intervene with this and offer ways to quit, like nicotine gum or patches or medications. Nurses need to be gentle when they approach this topic because patients may be embarrassed by how much they smoke and the way it's affecting their medical condition. These teaching points are crucial so that the patient knows how to prevent a future ulcer and how to control her current ulcer healing. Thank you so much for joining us here at CUW Hospital and for watching Nursing Channel 12. I hope you've enjoyed this and you've learned something about blood loss anemia. Thank you.